These patients often enough take several medications, and they're not happy about it.
Weight is not the cause of all of it, but weight and obesity is the common denominator across all of them.
If your cholesterol is high and I want to reduce it, I can prescribe you a statin and it'll reduce your cholesterol, period. If your blood pressure is high and I prescribe a blood pressure medication, it's going to effectively reduce your blood pressure. Same thing with diabetes. If I give you metformin, it's going to reduce your blood sugar. But that's it. The only thing that will improve all three at the same time is modifying your lifestyle, is losing weight, and it has a huge impact on all three at once.
I tell this to my patients all the time. I have this discussion with my patients. I tell them the following. We're all tourists in this planet. You get it? We're not here permanently. We're all going to hit a wall at one point. So I tell my patients, since you know that you're going to hit a wall at one point, you don't need to have your foot on the accelerator to hit it faster. So, hello everyone. Welcome back to our podcast, Let's Talk Health. I'm Dr. Albert Benheim. I'm a family physician here at Fizimen in Montreal.
Dr. Assayag, also a family physician.
Dr. Yann Azoulay, family doctor here too.
So we are right now doing a big blitz on weight loss. Our patients really gave us some beautiful feedback, positive feedback on our podcast. And thank you very much once again. But also they asked us to discuss all those medications that we talk about nowadays in the news, Ozempic, Mounjaro, Wegovy, Zepbound. And so we did a podcast last week. I invite you to listen to it. I think it's really interesting. But this one today is catered to patients, a subgroup of patients that we see in our office, at our clinic, that come to see us for weight loss, but these patients suffer from, chronic diseases such as high blood pressure, cholesterol, diabetes, cholesterol issues, heart disease. And these patients often enough take several medications, and they're not happy about it. And somehow they get used to, taking these medications, and some of them feel prisoner, and they tell me, Doc, can you reduce these medications? I'm tired to take them. Sometimes it's twice a day, sometimes 3 times a day, before meal, after meal. Pas facile. It's not easy for them. So nowadays we have solutions for those patients, and this is what we're going to talk about today, because patients that take these medications are not necessarily, do not have to take them for life. Mm-hmm. So I want to hear about your approach when you see these patients that come to see you and that take these meds. What do you do with them in general to help them deal with this problem?
Yeah, so obviously every pathology, every health issue is different, but I try to gently explain to patients that weight is not the cause of all of it, but weight and obesity is the common denominator across all of them.
True.
So that if we're able to really try to address one thing specifically, it'll give us the best chances to be able to better control those health problems. Better control in meaning that we could reduce medication, better control it that we could have better sleep, better mobility, having all these changes that will improve the quality of life just by really focusing in on one thing.
So just for our viewers, just for you to understand, when you lose weight, your blood pressure comes down. When you lose weight, and mostly fat, and we'll talk about this in a minute, your blood sugar goes down. So, and your cholesterol goes down. So you can treat patients with medications, but you also can treat patients for these problems by helping them lose weight and become healthier What do you see in your practice?
You're right, and we tend to focus a little bit too much on what we can't modify, what we can't act upon, right? There's genetics, there's age, right? With age and with genetics, sometimes there's high blood pressure and diabetes. But we need to put more emphasis on the things that we can change or that we can improve.
Yeah.
Lifestyle, weight is absolutely a big one. And I tell patients, I like to say that, if your cholesterol is high and I want to reduce it, I can prescribe you a statin and it'll reduce your cholesterol, period, right? And if your blood pressure is high and I prescribe a blood pressure medication, it's going to effectively reduce your blood pressure. Same thing with diabetes. If I give you metformin, it's going to reduce your blood sugar. But that's it. The only thing that will improve all three at the same time is modifying your lifestyle, is losing weight, and it has a huge impact on all three at once. And so that's what we need to put our focus on.
So whenever I see a patient that comes to my office and for a checkup, for example, what goes in my head is how can I help this patient become healthier? That's what really my focus is when my patients come to a checkup. And like you said, very often the commonality, the problem, the underlying problem is this weight issue. And at the office, we work a lot with body composition. And often enough, when I go through the body composition, so we do a body composition test using a very specific tool, sophisticated machine, so that we know, how much muscle you have, percentage of body fat, etc. And when I go through this sheet and the report to the patient, often enough, they are like stunned at what I am telling them. And they didn't realize to what extent, I talk about visceral fat and all that, and they had no clue. And when I explained to them, they say, whoa, it's a bit of a shocker. But I tell them, listen, you're not doomed to take all these medications. We can help you become healthier. And by the same token, get rid of these medications or at least reduce them. So what's your experience when you talk about body composition with your own medications?
I find, again, that there is a lot of direct links with body composition and trying to improve different outcomes for different health issues like hypertension, cholesterol, diabetes that we spoke about. I think it goes even further than that. Patients with sleep apnea, for example, who are on CPAP is one of the main things. We always tell them, but I guess we're in a position, we have a luxury of actually having this weight loss program and seeing what weight loss does to patients. And these patients are no longer dependent, or most of them reduce their dependency on CPAP, have a much better sleep. In that in turn helps their blood pressure, helps their cholesterol, helps their diabetes. And it's really solely because of the physical weight loss and the percent body fat that we're seeing reducing on these patients.
I think it's important to remember that this, when we do the body composition, we look at the percent body fat. We don't, muscle mass is not a problem. It's great. Muscle mass is good. So it's not because you have a lot of muscles that you may have an overweight issue. The problem is the fat. It's the visceral fat, and at a molecular level or at a physiological level, that fat causes inflammation. That fat causes insulin resistance. We know that visceral fat and high percent body fat increases insulin resistance, which is the driving factor towards diabetes, type 2 diabetes, a lot of cardiovascular disease. So very important to address that and to remember that it's that's one of the causes.
So one of the things that I see with a lot of those patients who come to see me is that they think that they're doomed to take these medications for life, right? They were prescribed medication for blood pressure, and well, so be it. So I am on it for life, or they're on Lipitor for cholesterol. Okay, so and they keep repeating, renewing their medications, and sometimes we add more, more, more. But in my mind, and for you viewers out there, you have to understand that there are 3 states for each pathology. So let me explain. Whether you have high blood pressure or cholesterol, you can have a blood sugar that is completely out of whack. That's one state, meaning that you're not controlled, your blood sugar is high. That's one state. Like your blood pressure could be not controlled. Second state is, hey, your blood sugar is well controlled with medication, or blood pressure is well controlled with medication. But you also have a third state, which is blood pressure or blood sugar can be controlled with proper lifestyle, reduction of your weight, proper life habits. So meaning in that state, in the third state, you're no longer diabetic, you no longer have high blood pressure, you no longer have a cholesterol that is not controlled. And out of those 3 states, this is definitely the best state. So don't kid yourself. Medications don't fix a problem, they're a patch. So it's better to fix a problem than to patch it, because when you're diabetic, despite taking medication, diabetes does a lot of damage behind the scenes that you're not even aware of. So year after year, if you're diabetic for 30 years, well, you're going to get issues down the road. So it is always much better to fix a problem than to patch it. That's
the earlier we start, the earlier we act, the better the outcome. The better we have a chance at fixing it.
For sure.
That's very important. I want to tell a story of a patient of mine. Maybe you're watching, maybe you'll recognize yourself. Exactly to illustrate that point. This is a patient that came to see me for a checkup, for an annual checkup. A patient I've known for 10, 12 years maybe. And I hadn't seen him for in a while. We did a checkup maybe a year and a half ago. And at the follow-up visit, we go over the results and, not that good. This is a patient who had been healthy without any medications. And unfortunately, I had to tell him that his cholesterol is very high. The blood pressure was very high. The blood sugar was high. I mean, we actually had a diagnosis of type 2 diabetes on that day. And I told him, based on these results, you should really be taking 3 to 4 medications, and I should be prescribing these medications to control all of these issues. He wasn't so happy about that, didn't want to have to be on medication. And we talked about different options, different ways of improving this. So we talked about weight loss, obviously. And he said, let me do this. I want to lose weight. I want to improve my lifestyle. This is a patient who wasn't exercising, wasn't paying attention to his diet, actually enrolled in the weight loss program. 6 months later, had lost 50 plus pounds, all fat. He really worked hard. He was exercising. He did all, very, very, very motivated. And we redid all the tests after 6 months, and no more diabetes. So the blood sugar had normalized, blood pressure had normalized, blood cholesterol normal. He left that office. He left my office on that day without a prescription. He was very happy. But the reality is that fixed it. It really did. And we acted early enough that we were able to reverse that.
I think it's sometimes, it's not... It's taken seriously by patients, sure, but I feel like there's so many recommendations. Oh, you need to move more, you need to eat less, and all those things are true altogether. But what I've seen in practice is just the weight loss itself is able to reverse all these health problems. Just seeing less weight, less fat on a patient will reduce all these occurrences or all of these problems.
So we've been talking about medications, reduction of medications, but like you mentioned before on sleep apnea, there are other benefits in losing weight. Talked about getting rid of the CPAP machine. It's not fun to sleep with a CPAP machine. If you have to, you have to, but if you don't have to, it's even better, right? So weight loss does help patients, but there are other things. Arthritis, erectile dysfunction.
Sure.
We need to talk about this. So
joint problems. Joint problems is a huge category in there too. You know that just again the weight loss will be able to reduce the progression of different forms of arthritis, specifically in the knees. And we were saying a little bit earlier that the knees are set to carry 4 times of your weight.
So it's important for the viewers to understand. So for every patient that carry an extra pound of weight, it has 4 times the amount of force that is exerted on each knee every time you walk, every time you go up stairs or whatnot. So as an example, if you carry an extra 50 pounds of fat, that means that you're exerting an extra 200 pounds on each knee. When you do this day in, day out, your knees are going to wear out.
Yeah.
And this is where we see knee replacements and whatnot down the road. And a lot of our patients that suffer from obesity, even severe obesity or morbid obesity, have joint issues.
Well, again, to me, the opposite is also true, is that the more weight we lose, the 20 pound that you lose is going to be an extra
Huge.
80 pounds less on your knees. And again, it's the thing that we're going to usually notice first with the weight loss, that patients will see that they're much more mobile, that they're able to go up the stairs better, they won't have as much pain.
What about erectile dysfunction? Let's talk about this, because this is a subject that we don't talk much about. It's a bit of taboo, whatever. In our case, this is a daily discussion with our patients. They don't talk about it outside our office, but in our office, we discuss it. So a lot of our patients that suffer from being overweight or obese have experienced some form of erectile dysfunction, which has an impact on their sexual life, on also their mental well-being. They feel less empowered. So obesity is one of the main risk factors for erectile dysfunction.
Yeah, absolutely. And when you lose weight, you improve circulation, you improve blood flow, there's better erections. But not only that, as we said before, it reduces inflammation. It helps for high blood pressure, which is often associated with erectile dysfunction. The other thing,
levels play in there too. Yeah,
I was gonna say low testosterone with weight issues. When you lose weight, the testosterone improves. Same thing in women. In women also, especially around the time of menopause or perimenopause, losing weight often improves or reduces the symptoms of perimenopause and menopause. It's not a perfect fix, but it really makes a difference.
Sure.
So in the past, for all those patients that are listening to us, we used to tell the patients, hey, and the patients know that weight loss helped them, right? So, but in the past, the patients struggled.
Sure.
Okay. We saw the yo-yo game with a lot of our patients. They've been struggling to lose weight. However, today, no longer. We have very, very effective tools to help our patients lose weight and become healthier. So we see it time and again in our offices. We're very good at this at the office, but I'm sure your physicians can be just as good in helping you become healthier and getting rid of your medications, sleep apnea, CPAP machines, or even your joints or whatnot. So all in all, there is a solution out there. You're not stuck with your medication. You're not stuck with your CPAP machine. We have very effective weight loss program. We have in our office, we're over 95% success rate because our patients do not have to fight hunger through their process. They're followed by a team, very effective. We see that it works. We do this daily at the office. So please, if you have any of these issues that we talk about, don't just take it for granted that this is what it is. And I tell this to my patients all the time. I have this discussion with my patients. I tell them the following. We're all tourists in this planet. You get it? We're not here permanently. we're all going to hit a wall at one point. So I tell my patients, since you know that you're going to hit a wall at one point, you don't need to have your foot on the accelerator to hit it faster. So when you have all these problems, that's what you have. You're pushing the accelerator down. And I have some patients that are floored the accelerator. So please, think about it. We have solutions. We can help you. Discuss it with your physicians. You can change your life. You can turn it around. We have very effective tools. The GLP-1s are here to help. So inquire about it. And this is it for our podcast. So wish you well. And stay tuned for a more detailed information next week with respect to the GLP-1s. Be well.
See you
Thank
next
you.
week.